Welcome everyone, and on behalf of FrontierView, thank you for joining our webinar series. On today's webcast, we'll be discussing the transition to post-COVID-19 in Japan and South Korea. This is our first update to the view for these markets in 2021, and we'll be outlining what we can expect moving forward. My name is Sarah Gunnis, and I lead the APAC Client Services team at FrontierView, and will be moderating this discussion. I'm delighted to be joined today by Antonio Martinez, who leads our global healthcare research practice. Before we get started, we realize that some of you may be new to FrontierView, so I'd like to take a few minutes to provide you with a quick overview of our firm and how we support multinational executives. FrontierView is a premier global market intelligence and advisory firm. Our primary focus is on serving market intelligence needs of global business professionals at multinational corporations by informing them and powering their market monitoring, strategic planning, and international growth priorities. From the beginning, we built FrontierView to be different in three primary ways. First, our product and service model has been purpose-built to serve a global business audience. In every aspect of our work, we strive to separate the signal from the noise and answer the so what, now what questions that are unique to international business professionals. Second, our model, which we call strategic intelligence as a service, is the only market intelligence solution that bundles together information resources, analyst advisory services, and senior executive network events. Finally, our world-class technology, which powers the FrontierView desktop and mobile applications, and has been built with the sole purpose of informing our clients' workflows and decision processes. We are incredibly proud of our client base, which today includes a community of over 4,000 global business professionals and is growing rapidly. You can see a sample of the companies we serve here. If you're not a client and you're interested in receiving complimentary trial access to our FrontierView program, please request a trial on the comment box or visit our website, www.frontierview.com, and click on the Request Trial button. Having briefly introduced our company now, I'd like to take a moment and introduce to you our presenter. Antonio Martinez is the Director for Healthcare Research at FrontierView and supports clients on strategic planning, market prioritization, risk identification, and contingency planning, all very popular last year, in their most important markets. Antonio holds a bachelor's degree in international relations and affairs from the University of Pennsylvania, as well as a master's degree in international economics from the Johns Hopkins University School of Advanced International Studies, or SAIS. As a reminder, before we move into the content, you're welcome to submit questions by clicking on the Q&A box of the GoToWebinar application on the right-hand side of your screen and by typing them to FrontierView Webinars. If there are any insights that you see today as part of this discussion or any questions that we didn't get to answer, our client services team, myself, Raveen, Althea, and Yu-Chen will be happy to follow up with you directly. And with that, I'd like to turn things over to Antonio to take us through the agenda and get us started.
Thank you, Sarah, and thank you everyone for joining us for today's session. So just to give you a little bit of a sense of how we'll walk through this, we'll first start with Japan. Walk through basically our perspective, first with a kind of a little bit of a touch point around the macro environment context that will shape the healthcare landscape in 2021. Then we will discuss as well South Korea as healthcare landscape and evaluate how that market, which is very, very different from how Japan is, let's just say, going to drive this year's healthcare outlook. And then we will finish off with a little bit of session around the Q&A to answer some of the questions you may have that may come up throughout the presentation. Now, before we get started, and obviously here in terms of the dynamic around COVID-19, again, the post-COVID-19 world, as we discussed in terms of the title of this webinar, it is important to note that basically when we look at how we try to analyze what is happening, what will occur over the next year, we always start first, obviously, with the past trends and priorities that the healthcare stakeholders, healthcare policymakers have for the market. In many ways, COVID-19 has merely accelerated trends that were already present, and this is as true in Japan as it is for South Korea. Obviously, infection rates, both Japan and South Korea, have, at least over the last year, have had some of the, one might consider the better cases in terms of the level of COVID-19 counts in terms of infection rates, but that doesn't always necessarily mean that you don't see that these markets haven't faced significant disruptions in their healthcare sector and will continue to, especially during this winter. Obviously, questions around healthcare system preparedness, the finances of the hospital system, that's something that we take a very strong perspective on and view on. It really impacts what you should expect in 2021. Obvious questions around the macro environment driven by funding injections in fiscal space. What can we expect in terms of, obviously, as everybody's talking about, the COVID-19 vaccine rollout and implementation, but also around financing for healthcare in 2021. What does that look like, given that we have a clear idea in terms of what the government budgets are going to look like in this year, as well as the fiscal 2021, for instance. And obviously questions around political management and priorities. We've had a change in government, or change in leadership at least, in Japan late last year. What are the implications of that? That's certainly something that drives a lot of our perspective as we go forward, as well as questions as with any of these markets, the question around patient fear, reliance on fee-for-service, the level of elective surgeries, the level of patient footfall, treatment levels. What does normal look like? Or has many companies would state, how do we get back to whatever Q4 2019 was like? So we'll have a little bit of discussion as well as on this point. But before we keep going, I do want to open up for a question. We've just opened a polling question. Here is Sarah, if you would like to kind of walk us through this.
Yeah, absolutely. So we'd like to know from everyone on the line, what's the biggest driver of concern for your company's performance in Japan in 2021? We have a variety of answers, so you can just choose the answer that applies to you most directly. Persistently high patient fear levels driving low footfall, economic and financial challenges facing providers, government pricing and reimbursement policies, supply chain disruptions, and growing competitive threats. So we'll keep this open for about a minute and let everybody choose the answer that applies to them. This will give us a good sense of how you all are thinking about Japan in the coming year and what is the biggest risk or concern you have for 2021.
And obviously for many of you, it'll be a kind of a combination of several different factors, but we just want to say which one is the top of mind as you go forward through this year.
We have a variety of interesting answers that have just popped up, Antonio. Looks like the top three are actually the top three choices.
It's not particularly surprising. Essentially, the biggest pushback that we've been hearing from our clients, particularly when it comes to Japan, and I think it's going to be very clear as we walk through this presentation, is that it's not just one factor that is undermining performance. It's just a variety of these top three in particular, which has been basically how they are interacting one with the other, and have hit Japan, a market in a country where, if you're looking at it from a global perspective, you would not expect would be the hardest hit market, and continuously so, because again, it's not necessarily one thing where by the end of 2020, we were seeing a radically improving environment. But again, we'll talk through this as we walk through the overall discussion. Let's get started to give everyone a better picture of it. So obviously, the big conversation, the big point when we're talking about Japan is that the level, despite the COVID-19 infection rates remaining relatively low throughout much of last year, the economic hit that Japan has faced has been, let's just say, looks more like what you'd expect from a country that maybe was one of the top 5 in terms of infection rates globally, and one where we've seen a persistent level of low consumption, a big hit on exports, a big hit on overall demand. Obviously, all of these factors have driven an environment where, even as we will talk about in just a minute, the level of government stimulus is very high. The overall environment for this market from a GDP perspective is extremely negative, and where, when we're looking at 2021, the prospects for a rapid recovery in spending remains, let's just say, at least partially offset. And when we look at, obviously, from a quarter-from-quarter basis, there is some expectations of recovery, particularly as we leave the winter period for Japan. But it is a relatively weak recovery, one where if you're looking at when we get back to 2019 levels of economic growth or even economic development production, GDP levels of consumption, it is one where you should not even be expecting it until well into next year in the best of cases. This is still going to be a recovery year. So even as to say the level of the hole in the economy will not be as deep in 2020, it will be a gradual recovery environment. This is in spite of the fact that Japan has been one of those markets with the largest level of fiscal stimulus. And yes, within Asia, it is certainly the one where it's on another level, but globally as well. So obviously, as you put it all together, Japan, you would expect at least a certain level of much bigger, stronger growth and recovery, and it's something that simply we have not seen. And when we put it together as well with the perspective around Japan's dramatic winter resurgence of COVID-19, that's also going to drive and weigh on the demand recovery. Again, when you compare it throughout last year, even when we had these periods over the late summer, not just obviously first in April, but the second wave as well, they had a real negative impact on how our clients have seen kind of the healthcare space and healthcare demand, particularly patient footfall in Japan, how that's played out over the last year, and the situation is only getting worse going into this month. Now, obviously, the key dynamic here is that patient fear is driven, yes, obviously around fears around hospital settings, around COVID-19, but you see as well the impact around that recovery, that level of recovery that we were hoping for in terms of consumer confidence. Again, the numbers that came out through December, as you started to see that big jump as well in COVID-19 cases, you really started to see a big hit that, quite frankly, is going to continue into the first quarter, and the gradual recovery in household incomes, household spending levels is going to also remain a gradual process. We see that in retail sales, we see that in inflation rates. These are not positive signals of a incipient rapid acceleration of growth. And when we see as well the unemployment rate remaining at a relatively very high level, higher historically than we've seen in the last decade, that tells you a lot about the challenges that the Japanese economy, even with stimulus, even with a government very much focused on the economic recovery, this is still going to take time. Now, in terms of the demand recovery, and again, this is another dynamic, and I want to point to on the far left here. So this is an Imperial College YouGov survey. This came out, and it's not showing here, but it actually should show basically by the end of December, by about early mid-December, you really start seeing that return to earlier in the summer levels of concern. As you can imagine, as we've been seeing in terms of the information coming out of Japan, that number, that level of patient fear is all continuing to remain elevated. Now, I do want to stop here and ask a question because, again, when we're talking about patient fear, we're talking about questions around elective surgeries. We do want to ask this question. And this is a question that basically every executive's always asking us about is, when do you expect elective surgery levels to recover in Japan? Is it Q1 2021, Q2 2021, Q3 2021, Q4 2021, or is now your expectation shifting to basically 2022? And when we talk about elective surgery levels, we're talking about pre-COVID-19 levels.
Yeah, I'll just add here, many of you have already answered in the last question that's patient fear and low patient footfall is one of your top concerns for this year. So now we'd like to know from the group on the line, when do you expect some of these things to improve and recover? It'll be good to hear from you all, what those expectations are.
Yes, we have a good group of executives from pharmaceutical, medical device, diagnostics, so it should give you at least a good picture of what the sentiment within the industry, at least is starting to shape and look like.
Looks like we have some interesting answers, Antonio. Looks like the top one is almost 50% with Q3 of this year, followed by 2022 with 37% of respondents.
I can understand why there is that difference kind of in perspective. I think a lot of it also should be at least driven partially by what we're going to talk about in just a moment, which is really around the vaccine and the prospects for the vaccine and what that might look like through the end of this year. So obviously one of the dynamics that we won't spend too much, but when you're looking at the impact of that elective surgery discussion, when you're looking about the impact of overall, obviously hospitals in Japan, one of the key dynamics we keep hearing was also mentioned is the economics and financial difficulties that hospitals, that healthcare providers are having in this environment. And for a lot of our clients is when will their purchasing ability, obviously partially driven, greatly driven by patient behavior, but also driven as well simply by their own finances. When is that going to recover? So if you're looking at Q3, if you're looking at 2022, the general sentiment we've seen from many of our clients is that even if you get to that volume level, you're still talking several quarters potentially in terms of that recovery really gaining steam. And again, for our clients, when we look at the numbers, the available indicators of how pharmaceutical sector, and I'll show the medical device as well, 2020 has been, as you might imagine, as you know, an incredibly difficult year. Every indicator tends to demonstrate, even in the best of cases, when we're looking at drugstore sales, when we're looking at certain surveys of drug sales for OTC and as well as ethical drugs, as well as the import levels. It really is in a very difficult and kind of continuously difficult time, even as we go kind of later in the year, see the numbers come out for October, November, and December over the last few weeks. And from a medical device perspective as well, it's a very similar story. Again, you see some level of continuous kind of negative direction through the second half of the year in terms of imports and throughout the year in terms of the production levels. Obviously, in terms of the overall environment, there are significant differences within the product sets for this, but it does point to a very, very difficult environment for healthcare companies. Now, the Suga administration, again, part of the dynamic as we go forward is one where all the policies in the healthcare sphere are going to be driven by a kind of a combination around driving the economic recovery, driving the COVID-19 response, but also, and it is important to understand that as well, that there is certainly a perspective around fiscal consolidation and fiscal probity. Even as you're seeing some of the largest stimulus measures globally coming out of Japan, the fear around fiscal sustainability remains something that is very, very important if you're looking at Suga administration, if you're looking as well as the MHLW, if you're looking at the leadership around the COVID-19 rollout as well, within the government and within the ruling LDP as well. Now, what is in terms of the overall response? If you're following what's happening in Japan, you know that basically the rollout is really aimed towards of vaccines is aimed towards the end of February. In terms of the vaccine production, in terms of the approvals, in terms of getting this rolled out, the government hasn't set a single figure for, as we'll talk a little bit about what, say, the South Korean government, maybe what other governments across the region have announced in terms of their goals for this year. But as you imagine, as you can see that you have the Olympics this summer, you have elections in September, within the LDP. You have also certain elections more generally in the lower house in Japan. I think by October, I would say by October, there's a lot of dynamics that need to move forward in terms of driving that rollout. But again, it's going to be one that it's going to be a challenge for the government, and we'll still have to say the general expectation should not be that a full vaccination is very likely before the end of the year, even with perfect execution. So that's important to note. However, it is important to note as well that even before we came into the end of last year, when we were seeing the Q1 budget, you might call it the third fiscal year 2020 supplementary budget, which again is one of the, it's gonna hit in this first quarter. It's important to know what the three priorities were in terms of the fiscal support, fiscal focus of this budget. You see here, the first one is the local revitalization grants for COVID-19 infected areas. The second one is very important when we talk about the impact for hospitals and even pharmacies as well, is the emergency comprehensive support grant for COVID-19 healthcare facilities. Again, the government understands that there is a significant pain and difficulties that are faced by the private healthcare providers, facilities within Japan. It is putting resources to bear on this. Whether they're being taken off sufficiently is a big question mark there, but that is part of the focus. The third focus was around funding for the development of COVID-19 vaccine system, both in terms of paying for the vaccines, but as well in terms of the rollout. So it is a big priority. It was a priority in this budget, and companies should be expecting that to be a continuous driver of, let's just say, the short-term agenda. In the best case for Japan is that you see real momentum through the end of February, through you can say through the end of June, and you really start seeing kind of continuous momentum going into the fall. That is probably the focus of most governments. That's the focus of Japan from a vaccine perspective. So at least we can say it is a priority, it is a focus. That is kind of the angle that the Japanese government is taking. But it is important to know, if you're a pharma company, if you're a medical device company, there's still a lot of dueling pressures when it comes to this administration. The current Suga administration, they are in that dynamic around total health expenditure control, around the super aging population, around the fact that basically through the end of this year, this decade, you are going to see significant upward driven impulses for healthcare spending. And as anyone that knows Japan, often enough that has fallen on healthcare suppliers, particularly pharmaceutical companies, in terms of the spending. So we talked about the fiscal story for the first quarter of this year. Let's talk about rest of year, fiscal year 2021, which starts in April. So fiscal rectitude really still remains a priority. And it is important to note as you start thinking about the market, as you start thinking about the healthcare spending story, the government essentially increased Social Security expenditures by 0.5% of GDP, 0.5%, relative to their very high, yes, strong 2020 budget, and as well Ministry of Health and Labor and Welfare budget as well by very much the similar amount. And it's actually the first time in well over a decade, almost a decade now, where the percentage share of Social Security expenditures is actually falling as a percentage of the total budget, which is not what you necessarily would expect in an environment of this healthcare spending kind of challenges. Part of that is, yes, there was a significant increase last year. Yes, it is overtaken by the focus, as I said here, number one focus around the economic recovery and economic stimulus, which is where much of the rest of the budget is moving towards. But it's also about the government's really long-term agenda, or at least perspective, depending on how the elections go later this year, around restructuring the Ministry of Health and Labor and Welfare, adjusting but maintaining pricing policies. It is a focus very much around controlling the spending levels when it comes to healthcare. And again, when we look at the MHLW, the minimal increases, as I mentioned before, it is very, 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 very minimal. Still, obviously, the highest it's ever been. But if you're thinking about, hey, the level of elective volume recovery, this does point to, at the very least, that no one's expecting that this is going to be a full year where the recovery is going to be so fast that basically the healthcare spending is going to expand much faster than the government expects. That is not built in, at least in terms of the assumptions that the government has through basically April 1st of 2022. So take that into account as you're looking and monitoring what is going on from a policy perspective. Now, there are some semi-priorities, you probably heard quite a bit, around long-term care, around fertility treatments, around childcare, part of the overall agenda around government finances, as well as in terms of social policy. Those are important to note, but it is important to note the overall story is a little bit tough. It's quite a bit less, you might say, expansionary. Now, of course, this year, at least in terms of the biannual fee schedule revisions, we don't have those scheduled until April 2022. But it's important to remember that the government is going to be paying attention to this, focusing on this agenda through the end of this year, and particularly in the summer when it comes to major reforms coming into place. With medical device companies particularly should be paying close attention to discussions as through the second half of this year. Now, we do know that there was the annual the pricing survey earlier this year, and we saw the pricing revision measures, which for most of our pharmaceutical clients proved to be a bit tougher than they were initially hoping for or expecting. Came in line with kind of a bit of our expectations. Again, basically, for those who do not know, products with price differences larger than 5% are going to face yet again another price cut revision downward. The government is looking, this is one of their major tools that they are leveraging to drive down overall Social Security costs. The fact that they could increase it to the level, to not increase it more, given the dynamics of a rapidly aging society and the actual usual increases in Social Security spending, that tells you where the continued focus is and remains around driving further pressures, reducing the burden on the population, on premiums, on the out-of-pocket from the overall population. And when it comes to pharmaceuticals, this is not finalized. There's also a question around that post 80% target for generics and biosimilars policies. Again, the government is going to continue to focus on this. The government just announced that they're coming out with a new kind of long-term strategic vision for the pharmaceutical sector that they will be developed over the summer, along with other reforms, which we'll talk about in a minute. But it is important to note that this is something that companies should be paying attention to. They did not hit that target. They hope to hit it in the next few months, but it is something that companies should be paying close attention to this as well. Social Security reforms, again, one thing that we were supposed to see last summer, and that theoretically at least would have, in the original plan, would have meant that the level of aggressiveness when it came to the annual repricing survey and the outcomes that we'll see on April, by early April, that we wouldn't see that be as aggressive. The government will start discussing and talking about that over the summer. Again, this is going to be a very much jam-packed year in terms of policy development, even though many of those initiatives really won't start hitting a lot of companies until fiscal year 2022. There is one other dynamic that the government is concerned about, and it's important to note as you are looking at Japan. It is that policymakers are also concerned about shortages because of these policies, because of the measures around reductions, as we saw, the level of reductions around production, around imports, around just pricing policies. Again, many of the concerns all mixed together. The government is trying to push policies on this front. They are looking to establish a stable supply of medicines plan. This is another key dynamic to monitor as you go in through the rest of this year. Now, in terms of the digital agenda, obviously one of the dynamics for Japan is the level, and that Prime Minister Suga has mentioned as a key priority, is that digital agenda measures. The government's going to take its time to launch an all-encompassing digital agency. That's coming in the fall. Again, there will be a lot of news this year, but the actual launch will not be until the fall. The policy measures will be about restructuring how different ministries work. But again, the perspective is towards more of an improvement, more of a, not just for digital health, but it is digital healthcare is in the Ministry of Health and Labor and Welfare will be a big focus of that. But that is something to basically still in the future in terms of the agenda. Obviously, we've talked a lot about a slow economic recovery, continued pain, yes, some fiscal stimulus, less spending necessarily, spending increases for healthcare overall, but it is also, the government is trying to strive to pursue, at the same time as it's developing all of those measures, a long-term agenda around innovation as well. Some of that is about also value. One should also mention when it comes to HTA policies as well. So that's another key dynamic which will be further developing and be a bigger part of the fiscal year 2022 discussion. Obviously, the Sakigake system was rolled out, fully rolled out last year. That is another key positive measure. But again, in terms of the key takeaways for the Japanese market, the key dynamics to understand is that we do actually still expect a certain level of recovery this year. You will see a recovery. Obviously, last year was a difficult year. We expect that recovery will be partial. Really, 2022 is probably the year where you're going to see a much stronger recovery that one can plan for. But it would be one that is going to have to be driven, most importantly, more than any stimulus measure, it will be driven by the COVID-19 vaccine rollout this year and the quickness of that, and whether we can avoid another winter like this winter in Japan. But again, all of that within the context of continuous price controls, price containment, because this administration, or even a future administration that we might, different administration that might come out in the towards the end of this year, they are still going to be putting on a very high priority around some level of return towards fiscal prudence. So those are the important dynamics to understand what 2021 is going to look like in Japan. Now, I know we want to also make sure that we have time as well for a Q&A as well as for South Korea. But we do want to kind of ask the same question that we asked for Japan in South Korea. And this is about the driver of concern in this market in 2021.
Yeah, I can just add, Antonio, we saw that you were all worried about returning patient fear levels and driving low footfall for Japan. We'd love to know what your concerns are for South Korea for the year ahead. Many of you looking at them as two different markets, but how do your concerns for 2021 pan out? Are they different or similar? We have some interesting results coming through, Antonio, actually quite different from what we saw in Japan, with 45% answering government pricing and reimbursement policies as the key concern for the year ahead.
Well, that's probably the right answer, at least to a certain extent when it comes to South Korea, because it is a very different story, very different healthcare system, a very different healthcare market, and even how it's been responding, obviously, to COVID-19. Now, looking at the basically the perspective on South Korea, it is a different story. The level of the downturn that we saw in 2020 is nothing in comparison with what we saw with Japan, and the level of recovery that we expect this year is going to be a very strong rebound. Again, there are still some dynamics where you're going to see it's going to be partially at least driven by stimulus, partially driven as well by exports. Some of the other dynamics will lag a bit, and so some of the concern around some of the other dynamics in South Korea are important. But obviously right now we are in an environment where, again, that winter outbreak, similar to what we have obviously in Japan, is important to note, as well as whether that fiscal stimulus package, the level of gradual consumption recovery, continues to gather pace. Now, obviously, as we're looking at here, South Korea is a little bit further ahead in terms of its ability to gradually kind of bring that winter COVID-19 resurgence under control. Again, South Korea has had, similar to Japan, a couple of periods, slightly different time frames, but basically a couple of periods where you saw that COVID-19 surge. And this certainly has been the worst of them. But the general sense within many of our clients in South Korea is that relative to Japan and how that response has been there, South Korea has been stronger. We've seen in terms of the government as well pursuing from the beginning, even faster than the Japanese, expansionary fiscal agenda supporting medium-term economic growth. Again, the debt levels is going to be increasing. And the government has as well, coming out for 2021, an agenda focused around the digital New Deal and the Green New Deal, to the importance that it has for the healthcare sector, certainly around some of the measures which we'll talk about in just a bit around the digital New Deal. But it tends to demand the factors as well is that when you're looking at the recovery here in South Korea, again, not a perfect environment, not a we are 100% back to normal, especially with this COVID-19 winter resurgence, but it is in a better, more superior landscape and environment than say what we would have feared even a few weeks ago, a few months ago. Now, in terms of the household spending levels, again, the COVID-19 situation is going to be a big factor driving whether that recovery, that level of improvement will continue, or let's just say that the level of stability and sustainability that we saw on the consumer, on the patient side, continues. We expect it to improve. And again, that K disease, which we are very proud of, prevention strategy has certainly mitigated a lot of the negative impact on healthcare demand in this market. Again, relative to many of the other countries that we could be discussing today, whether in Asia, whether rest of the world, the level of impact is relatively small when we look at the numbers coming out of the South Korean government that had what they've collated during the depths of the crisis. Now, budgetary support, which we're not going to get too far into in terms of the history of it, but obviously when you look at it, the same level of support for hospitals, the same level of support for patients, the same level of reaction and prevention measures have been pretty strong throughout the many different budgetary supports that we saw in 2020. Now, again, even with all these dynamics, we still are one where we need to discuss the fact that basically, even in this environment, even after all the cuts, all the spending increases that the government is planning for, it is important to understand that the Moon Care expansion is still very much in line. The government is going to continue to finance it. It has the resources to continue to finance it. And Moon Care is still going to be part of the policy. Now, when you're talking about pricing and reimbursement policy fears, obviously for a lot of our some of our clients where they're seeing that expansion in public support, yeah, that's going to go with tougher reimbursement policies, tougher pricing policies going forward. That is not going away. When we look at the NHIC priorities that were set up for this year, again, very much of them are around financial measures, around driving a certain amount of fiscal responsibility. And again, when we look at Moon Care overall, this is something that needs to be essentially pushed through over the next couple of years. And again, through 2022, that is the plan, that is the focus. So companies should continue to expect that which has not already been implemented. We are heading into that period, the next 24 months, where the progress needs to be there for the Moon administration. Now, again, positively, the financial conditions that we see, at least in terms of the major South Korean hospitals, have remained a relatively strong footing. They were on a strong footing before the crisis of COVID-19 than say what we saw in Japan. And they remain, relatively speaking, given some level of government support, given the relatively more limited impact in terms of patient fear, generally speaking, that we've seen in South Korea versus Japan. And again, that we do expect to see, and it's important to note the similar dynamic that we saw around that COVID fear level increasing significantly towards the end, towards the beginning of that surge. Again, the dynamic is one to continue to monitor, but generally speaking, South Korea has taken an approach that is very much what we can describe as proactive. Now, one thing that I haven't mentioned up until now, and it probably bears significant focus, is the budget as well as the vaccine strategy for this year. Okay, so the first thing is that obviously, the Ministry of Health and Labor and Welfare spending increases by an average of 7.7%. The government has, unlike in the budgets that we saw for 2020, 2021 was not one that was the healthcare sector is the primary focus of our efforts. We talked about the digital New Deal. We talked about the Green New Deal. Those are the main priorities, the fulcrum of a lot of the policy agenda of the government. and it is around driving an economic recovery, driving an industrial recovery as well, not just kind of a consumption recovery. There are several policies, and I'll start here at the top in terms of some of the measures that that were among the healthcare spending initiatives in the budget. Again, smart healthcare infrastructure. They put some limited resources. A lot of resources went into developing that disease prevention system. This is a tell here, and it's important for you to understand. The government came with a strategy as of when they were formulating the budget for 2021, with the expectation that a vaccine was unlikely to be ready early in 2021. So a lot of their response and focus was really around developing the disease prevention protocols and mechanisms to continue to invest in it. And yes, developing engine by investing in vaccine and treatment development. It's like these are part of the overall policy. But again, there was not in that initial budget significant resources to actually support COVID-19 funding for vaccines. That actually came in December, came because of opposition calls for a significant financing increases. So one thing that you have to understand about South Korea is that in terms of their the purchasing of vaccines, South Korea, which one might not expect, is actually a little bit late to the game on that policy. We should expect to see kind of the beginning of that COVID-19 vaccines by the end of February. But many of the purchases are not going to come in until later, a little bit later in the year. South Korea is going to get those resources. The plan of the government, and this is probably right now what they are communicating, is to essentially get 60 to 70% of the population with the vaccine by November 2021. So 60 to 70%, what you might describe as their expectation of herd immunity levels by November of 2021. So there is no expectation that it's necessary to get it done quickly in the first half of the year. There is essentially a policy of getting this done before the beginning of winter of next year. So that should be kind of the expectation. Obviously, South Korea has been very effective at managing COVID-19, among the more effective countries in the world. But that is important to note as you're looking at what this year will look like. How vaccines, how that rollout will impact early in the year, what the market demand or level of disruptions that you might see in terms of in the market. Now, obviously, there's other policies around continued support. Again, the government wants to drive, and as we'll expect, as part of our forecast, see significant economic growth that will expand demand, that will help expand private healthcare spending, out-of-pocket healthcare spending. So the overall environment is still very positive, but it is important to note some of these factors that will kind of put a wrinkle to the perspective around South Korea. And again, the financing pressures we expect to come. They're just not going to come, at least from a financing perspective, not necessarily in terms of the actual reimbursement rates that you'll face, but the healthcare system, that level of expectation in terms of premium rates increases, that's more of going to look like a 2022 discussion at best. Again, the domestic production and export growth has generally been relatively positive, according to some of the estimates that we've been seeing coming from the government. And overall, how that's going, a very different story, very different picture than what we've seen coming out of Japan. Finally, there's a couple of other topics that we wanted to mention as part of this conversation. Again, to the extent that there is some level of uncertainty, it is around government KMA relations. We've seen a level of that. We saw the strikes early in the year. We've seen the government continue to try to push forward several policy measures, particularly around the number of doctors, the establishing of the public medical school, which was included in the 2021 budget, also almost at the last moment. And the future around telemedicine beyond COVID-19 emergency use. That is another key dynamic that we saw a significant uptick of that going into the end of this year, towards the middle of last year, as we saw that emergency use for telemedicine. Again, its final legalization has been a focus of governments over the last decade. That is something to watch in terms of the policy environment. Now, finally, in terms of the key takeaways, again, conversation when we look at South Korea is much more positive overall, and one where essentially the dynamics of growth will continue to be important. It is important if you're looking at this market, the public healthcare sector is going to be the government, Social Security. That's going to be what's going to drive more and more of the spending in this market in a post-COVID-19 environment. So that is going to have real implications around the pricing, around the reimbursement environment in South Korea. And companies should be basically expecting that COVID-19 has, if anything, accelerated that process. And the relative political success of the Moon administration only augments that fully as we go into the rest of this year.
Great. Thanks so much, Antonio. That was excellent. And I think certainly informative as we think about what some of those concerns were from the audience over the course of this year. So a lot to think about and build into our plans. I know that we want to have some time for the Q&A portion of the webinar. We have lots of questions coming through. If you haven't submitted a question yet, please share them with us via GoToMeeting Messenger by sending your questions to FrontierView webinars. Antonio, I have a few questions here to get us started from the audience. Maybe we'll pull out this one first. Are there any policies that the Japanese or South Korean government is pursuing to drive greater localization of pharma or medical device manufacturing? I know this has been on the top of mind for many of our clients in recent months, so it'd be good to hear your thoughts here.
So we start with Japan. Obviously, one of the dynamics that the Japanese government had kind of even early in terms of the budgets that they were coming out, the supplementary budgets to deal with COVID-19 was about reshoring, or at least trying to drive away for certain supply chains out of China. This is particularly acute as we started to see all those export controls at the beginning of this crisis. I think the Japanese government still wants to see movement in that direction. Obviously, some of their pricing policies, their local policies, focus on generics to some extent, have undermined some of the desire to increase local production. Again, local production in these sectors has been coming down, at least in total terms in 2020. Yes, driven by local demand, maybe driven partially by external dynamics of demand for this sector. It's particularly acute in the medical device space. But it is something where the Japanese government is part of their medium-term solution, but the policy agenda needs to be kind of more substantial. We'd have to see more from them going forward. South Korea, again, an industrial policy perspective, particularly what they call biohealth and what they call obviously in the diagnostic space, in the testing space as well, coming from COVID-19. Again, that K prevention approach, the desire to see therapeutics such as Celltrion's therapeutics and a eventual COVID-19, locally produced COVID-19 vaccine, which they expect to be ready by the end of this year. Those are dynamics that the South Korean government wants to continue to support and drive investment to, and they are driving certain kind of R&D investments in those segments and trying to drive continued local innovation and R&D as an export platform. But again, the key dynamics here is the pricing policy, the reimbursement policies aren't always supportive of that. Now, South Korea sees it more as an export platform, so that could work. But those are two dynamics that are kind of working against each other in terms of some of the decision making, in terms of the environment for investment.
Thanks, Antonio. Certainly something to watch, and I know we continue to get questions on that, so I'll keep monitoring that for you. We have another question here, and I think this one has been quite interesting, not just for these two markets, but globally. But certainly when we're thinking about Japan and Korea, how confident should we be in terms of rapid vaccination in these countries, given the rising fear over safety around the COVID-19 vaccines?
Yeah, part of the dynamic that you probably read a bit of that in the press has been, in the case of Japan, just longstanding vaccine fear. Japan has a relatively high level of, I would say, cautious sentiment towards vaccination. In South Korea has faced certain scares, even around the flu vaccine late last year, that are driving a little bit of concern about the take-up. Again, I think some of that can be a little bit kind of overblown. We're still not going to be at that point where we're going to see, they still need to kind of come out with the vaccine, roll it out, and see the level of take up. But again, this is going to be part of the public communication and discussion that the governments, in these governments, which particularly in the South Korean case, had a very successful response to COVID-19 in 2020. This is going to be obviously be one of the top, and one that just yesterday, I think the president of South Korea had to mention that, you know, no one should be afraid of these of vaccines. So it's going to be a communications challenge. It is part of what, say, a downside risk as you're looking at the opportunity as the outlook for this year, for sure.
Yeah, thanks, Antonio. I think, given some of the parts of the presentation you shared, where we know that that's a major driver of recovery, this is certainly something to watch. And we have a question that's relatively related to that. When we talk about the slow rollout of COVID-19 vaccines, do you think this would create an impetus for greater regulatory transparency in either Japan or Korea?
I think in Japan, it's actually something that let's just say the LDP, the ruling Liberal Democratic Party, that actually started to come out a bit in terms of the agenda for COVID-19 after this, because a part of the, let's say, concern or angst that we've been hearing coming out of Japan has been because of the slowness and the uncertainty and the lack of visibility around PMDA decisions around vaccine approval. And the push, the kind of the desire for a big push coming from the Japanese political policymakers, that they want to see greater transparency. There is the potential that you're going to see a bit more visibility. Some of it may be kind of centered on the vaccine approval in that section, but you could see a kind of a bigger shift towards greater openness on that front. Against around South Korea, I think the degree to which we see a smooth rollout of vaccines this year will have an impact on sentiment towards the government and potentially sentiment around kind of basically the regulatory bodies and how they make decisions on these fronts. But less clear-cut story that you can see of that happening in South Korea.
Thanks, Antonio. And I think that is starting to give us maybe a little bit of a glimpse into a little bit of the longer term. I know that we're all trying to figure out what's happening in 2021, but we also have many clients who are starting to think about their longer term planning as they're looking at their 3 to 5 year, which will come up probably in the next quarter for many of you. So there's a question here that I think sort of maps pretty interestingly to those activities, which talks a little bit about beyond this year. Which are, should companies expect public healthcare spending to increase or decrease as we see a post-COVID-19 environment normalize?
I mean, in South Korea, the plan is, and again, the government, at least through 2022, you should be expecting a continued increase in public healthcare spending. The only dynamic is whether that is going to be done with a significant amount of squeezing of basically of the kind of prices and reimbursement rates that companies would want to face or have in the South Korean market or not. In Japan, well, we're going to see another level of those price cuts. I mean, of the biannual kind of fee schedule revisions, and it is more likely than not that they will be aggressive again. Again, the government would prefer that all of that aggressiveness was being done in an environment of a growing economy, which is hopefully what we will see in 2022. But again, unless you see pretty big progress on other measures to control overall spending, you're still going to see public healthcare spending probably at least, yes, increase a bit as you see all of those elective procedures, the level of delayed treatment levels come back to a level of normalcy. And again, you're looking at Japan, you're seeing a market that basically the population is continuously aging. That's not going to change. And if you look at just from that factor, the volume level is going to go up, but the pricing, let's just say the government is going to try to bend that cost curve as much as possible. And I expect that's going to be through pressuring to some extent some parts of the population, the more well-off population, but it's also around kind of just pressuring on prices as well, and not just for pharma.
Thanks, Antonio. That's certainly insightful. And I think a lot of our listeners today will get a lot out of this session, especially thinking about this year and certainly thinking about the years to come and what recovery could look like. Of course, we're going to continue to tweak our view as more information on policies and markets come in. But I think we're nearing the end of our time for today. I know everyone has a busy day. We'd like to get you out on time to continue your activities and your schedule. So if there are any questions that we were unable to answer on the line today, be sure to follow up with responses and through your client services manager. So again, myself, Raveen, Thea, Yuchen, happy to get back to you shortly. And everyone will receive a recording of the presentation within 24 hours. So please feel free to rewatch if you missed anything. In the meantime, you can view the webinar materials and much more on our mobile app, which is available for you to download right now on iOS or Android. For complimentary access to our suite of resources, once again, including data, dashboard, tools, market monitoring reports, please email us at info@frontierview.com and a member of our team will be in touch. We'd like to thank everyone for taking the time to join us today, and that concludes our webinar. We look forward to speaking with you all again soon. Thanks again.